culture work. And we are thrilled to have everyone here for this really important conversation as COVID-19 continues to evolve and the impact on the arts and culture sector continues to evolve. I've heard many of you talking about when can we, what are we hearing about the guidance? What's going to be happening? What's the state of things? What are other organizations doing? And so this is a perfect opportunity for us to bring this group together to talk about all of that. Today we have Dr. Melissa Verrey, who is the acting director for the Richmond and Henrico Health Districts. I hope I got that right. And we also have Emily Rich, who's an NPH epidemiologist with the Virginia Department of Health, here to tell us, share with us their perspective about the current state of COVID-19 and the guidance as it impacts arts and culture organizations, and also to take your questions at the end. So first we will hear from Dr. Verrey, then I'm going to share some survey results with the group. Thank you to everyone who took that survey, talking about sort of current state and your thoughts on future state. And thank you to all of you that submitted questions. And so after I go through the survey, then we'll turn things over to Emily to share with us her thoughts, and then we'll do Q&A. I will also say Dr. Verrey will need to depart shortly after her remarks. So we'll leave a little bit of Q&A time at the end of her opening remarks. With that, I think in the chat, we're going to share the usual guidance about, one, this is being recorded. So just know that, please. And two, share some etiquette about our etiquette for Zoom meetings. Aaron, before I move on, anything I've forgotten? We're good? All right. Then with that, I will hand things over to Dr. Melissa Verrey, the acting director for the Richmond and Henrico Health Districts. Dr. Verrey, thank you so much for joining us.
Thank you for having me. Thank you all for being here today. It's been a long road, and I think it might help us to put things in perspective and kind of see where we are now. It's just really a brief thought on where did we come from? What have we been doing for the last 2 years, very briefly. And I'm just looking at there you go, sharing my screen here. Where were we, oops, there you go. Oh, starting myself off there. Where were we coming from, and where are we going with all of this? Where have we been, where are we going? And what does it mean what do these new recommendations mean? And just a very brief synopsis on that. And then take your questions after that. So just to get us started, it's been almost, it's been 2 years since this pandemic began, and it's been a really long 2 years. I think if you remember back to 2020, this was a brand new virus we knew nothing about. We had a population with no immunity to it, and we just knew more. We knew a whole lot more that we didn't know. We knew we didn't know a lot. We knew we were treading new territory. And then at the same time, we were seeing this devastating loss of life in our nursing homes, in our families, in our elderly, and our medically fragile. And we also had to manage lockdown because we were trying to contain this thing that was just devastating our communities. And so we also had to learn how to do Zoom calls. We had to learn how to get our groceries delivered. We had to learn how to, manage all of these different issues. But we did learn a lot. We learned about social distancing. We learned that masks worked. We found that there were good, tests to determine when infection was present. And we started to see some therapeutics that were available for our most ill. Fast forward to 2021, we had vaccine, and 2021 vaccine, it continues to be the biggest thing we have to fight COVID. It started in 2021, continues to this day, our greatest tool for against COVID-19. Certainly in 2021, we initially had problems getting enough vaccine out to people because we didn't have enough vaccine. And then and through now, we are struggling to get people to take the vaccine. And that is something that we continue to see to this day. But we learned things as well then. We learned that vaccine immunity waned, and we needed boosters. We learned about variants. We saw Delta, we saw the beginning of Omicron, and we understood that, although we might still see transmission in vaccinated folks, we still continue to see that vaccine protected against severe disease. So we learned a lot. We developed more new therapeutics. We had better at-home tests, and the world just kind of changed from 2020 to 2021. And so in 2022, where are we now? Well, as you know, cases from the Omicron wave are declining really quickly across the nation, and in our parts of Virginia in particular, things are just looking a lot better. We've also learned from Omicron that perhaps, it's been really tough because Omicron was so much more infectious that our case counts dwarfed anything we had ever seen before. We had to change the scale on our graphs because they were just that much higher with Omicron. But despite that, we didn't see as much we saw a lot of hospitalization because there were so many cases and it really strained our healthcare system, but we didn't see as many as we thought as we would have seen had it been like Delta. And we think that's for a couple of reasons. Omicron itself might be milder, and we have a lot of folks who've been vaccinated. And these together have really changed the landscape and how we have to think about how we think about COVID, how we think about our mitigation strategies, and how we think about the road forward. We know that this isn't over yet. We are watching what's going on in other parts of the world, like Asia right now, where there is still booming activity, because that to me is a risk for new variants to arise. And I do expect new variants to come down the pipeline. And so what we hope to see is that where we're at now with continued ongoing vaccination and boosters and the treatments we have now and the tests we have now, is that perhaps we can get to a place where things are a little less disruptive than the last 2 years have been. Maybe it's less disruptive to our work, less disruptive to our economies, to our schools, and find a way to kind of so-called ride the waves of these new variants as they come through. So there you go. How do we ride these waves? How do we do this? First and foremost, I've said it 30 times already in the past 5 minutes, and I'll say it another 30 times: vaccine, vaccine, vaccine. COVID-19 vaccine works. It protects against severe infection and death and hospitalization, and it keeps us from overburdening our hospitals. And so it's going to be a key thing going forward to make sure that we continue to stay up to date on our vaccines, whether it be making sure that folks get their primary series, making sure that we get boosters, make sure we keep an eye out for any additional recommendations for additional boosters if they occur. This is going to be the mainstay of what we do going forward. Number two, making sure we have testing. Tests are wide. I know during Omicron, we got a little strained there because we had so many folks getting exposed. But having tests available, whether it be going to your doctor's office, going to the Rite Aid, to the CVS, having home delivery tests from the federal government, having tests available in case you're symptomatic or in case you're, that you were close contact to somebody with COVID, is going to be a key thing for us to be able to know if you have COVID, if you're positive, stay home and stay away from others so that you can keep them safe. And then additionally, masks, when we have high levels of COVID activity in our communities, will continue to play a part. I understand that there are pros and cons to, sometimes people feel like, it may interfere with some developmental learning in small children, but when community activity is high with COVID, it is an additional layer to provide protection against transmission. Question you'll have for me is, all right, Bray, when do we wear masks? Do we have to wear masks? And this brings me to this new set of metrics from CDC. I mentioned that when we saw Omicron, I did mention this, we saw that there were fewer hospitalizations than we expected. And so even though we had cases didn't necessarily represent how many people were coming to the hospital, how much of a burden, how much severe illness we were seeing. because it was just wasn't behaving like Delta or like prior COVID strains. And so CDC has revised its metric to look at both case counts or case rates, how many cases are we seeing, but also what is the burden on our healthcare system and how many folks are we seeing who are hospitalized with COVID? Because that's a predictor, it's a better predictor of how much of an impact on our communities with regards to severe disease and not being able to go to the hospital are we going to have from whatever variant it is. And they have generated this community level, and there are 3 levels, and our mitigation strategies can vary based on the community level. So when we're in high, for example, that is going to be where we may need to see people, recommending masks in indoors when you're in public and you're indoors. That may need to be when we need to wear masks. We may need to see additional mitigation strategies applied in workplaces if we're in high community level, if our community level is high. If you are going to be spending time with someone who is vulnerable, you're going to want to wear that, you may want to consider wearing that mask or getting tested before you see them when we're in community level that's high. But we have medium level and low level. And right now, I'm just a advance notice, we're in low right now. But in medium level, you can always opt to wear a mask. It's always okay to wear a mask. But perhaps when we're in medium level, the impact on our hospitals and the number of severe illnesses isn't as high. And so we can opt to not wear the masks when we're indoors in public. We should make sure that we continue to stay vaccinated. And if you are an individual who is predisposed to severe illness, you may want to talk to your provider both about whether or not you should continue to wear a mask and whether or not you should think about talk to your provider about whether or not you need to go on pre-exposure therapy to prevent you from getting severe disease in the event you get infected, or other therapeutics if you do develop COVID. And then in the lowest category, or low or green, while you need to, that's where we feel the most safe, or it is the safest that's when we're safest in going out in public and maybe being a little closer to our normal. Perhaps we are able to, go back into the office and have meetings, go ahead and attend live performances without masks and being more comfortable about that. However, what this lets us do is, should we see more activity, more COVID infections coming up, or more, another variant come down the pipeline, we can watch this metric and see, okay, now we're going from low to medium. Maybe we need to think about, what that means for our folks who may be moderately vulnerable. Oh, and if we go into high, maybe that means we need to put masks on in indoor public spaces. And maybe that means we need to think about social distancing and other mitigations to prevent transmission of whatever this new variant is. And oops, there you go. But again, like I mentioned, we're in low right now, and that's great. We'll continue to monitor it. And locally, by locally, I mean Richmond and Henrico. And in general, the Richmond area, for the most part, has been in the low area, a little bit of medium and low. I think what this means is that we still need to stay up to date on COVID vaccines. If you are exposed or you have COVID and you've been tested positive recently, we're still going to want you to wear a mask. We're still going to want you to stay home until your infectious period is over. I think we should change our behavior as a society, where don't go to work sick anymore. For a long time, I feel like folks would go to school or go to work with a head cold. We need to stop doing that. And no, it's a challenge, but this has really taught us, especially with COVID. COVID is not the flu. COVID is not a head cold. COVID still kills more people. COVID is still harming more people than our regular colds or regular flu or the flu that you see every year. We still need to make sure that when you're sick, stay home. Don't be passing that around to others, and make sure that you're taking care of yourself as well. But obviously not done yet. We'll continue to work, we're not done with COVID. We'll continue to watch for waves. We have a tool now to help us ride those waves. And in addition, we still have more vaccinations coming down the pipeline. We're still waiting. I'm still waiting to hear whether or not baby Pfizer or the Pfizer vaccination for our youngest folks, our 6-month to 4-year-olds, will get emergency use authorization from FDA. Still waiting for that. Still waiting to see when 5 to 11-year-olds might be eligible for boosters. We anticipate that happening in the next couple of months, so keep your eyes peeled for that. We have, I have not yet seen any consensus on whether or not we will need additional boosters, but keep your up beyond this first set of boosters, keep your eyes peeled for that. And then again, therapeutics are growing in availability, both for pre-exposure prophylaxis for those who are very, very vulnerable. And then for those who are at risk for more severe disease, whether or not that be because of weight, because of medical conditions, because of mental substance abuse, mental illness or substance abuse, any of those risk factors that they've listed on CDC's website. We now have therapeutics that you can acquire. You can have your physician order it, get it at the pharmacy, or we know that the White House is rolling out a test to treat in pharmacies across the nation, where hopefully you will be able to go to like a Minute Clinic and be able to access both treatment or testing and treatment at the same time through one of their providers there. More to come on that very soon. So as we go into 2023, 4, I do think what we're looking at is a succession of waves. It doesn't need to be that disruptive. It doesn't need to be lockdowns, totally turn your life upside down and shove it into a box. It's not going to be like it was. I think we can come back to a less disruptive version, a less disruptive relationship with this virus, where sometimes maybe we need to go ahead and wear masks, be a little more distant, but then when things are quieter, we can go ahead and take those masks off and go ahead and participate in live theater or performances or going to work in person and all of those things, and just learn to ride the waves as they come forward. And then as we continue to learn more about this virus, we obviously our understanding will continue to evolve, and we will continue to adapt as that continues. So I think that's all I had. Yes, that's all I had. So if you have any questions for me up front.
Thank you, Dr. Bure. Really helpful and enlightening and calming at times. The one thought before I get into some of the specific questions from the group, you touched on the word distancing a few times, but I haven't really seen that in any of the guidance that's been coming out from CDC, or it's not talked about as much.
Yeah.
Can you speak to how much the 6 feet requirement still is important to us? That's something that particularly impacted performing organizations, because we had to keep musicians 6 to 10 feet apart.
Right.
Can you speak to how important that is in the new world?
I think where here's what I've been telling folks is that it's hard to live in a world where everybody has to be 6 feet apart. Musicians in particular, that's very difficult. For larger performing musicians or orchestras or things like that. What I would say right now, based on what we know, is that since we're going back and forth between high, medium, low, not right now, but since we could go back and forth between high and medium, I'm not sure you want to ditch any structures or things you've put in place so that you can be ready to add those additional mitigation strategies. I think if you're looking at when you look at the actual guidance for the community levels, they talk about additional mitigation strategies in that high level. And that's kind of where in my head, I'm putting things like distancing 6 feet apart, because and so perhaps if we get into that high, you may need to retreat to having more distanced performances in the future. And so you may not want to get rid of whatever, plans or structures you have in play to be able to do that, but perhaps you need to lean into that less in medium. Unless, for example, you're in a congregate facility or, one of those special facilities. That's where I'm leaning into where social distancing may come into play again. I think, and for me, it's a bit of a continuum where I am more comfortable with crowded venues in low than I am in medium, but I understand that that's hard to make a policy out of my level of comfort in low versus medium. I would say when we get to high, that is where I think we should be thinking about distanced and other kind of mitigation strategies, more so than in medium, but be ready to go to high if we need to down the road.
Thank you. Do you know it will, or does the current guidance for performing organizations currently relieve that 6-foot requirement, or is that something that might be coming down the road?
So there's been a lot of updating. There's been slews upon slews of updating from CDC. I have not looked at that recently. I also noticed the absence of distancing being explicitly called out in the guidance. And I think that's to give people a little bit of leeway with regards to how that's implemented. I do not know. Here's what I'll say. I don't know if it's been updated yet. I imagine that they're going to propagate that through to all of their websites. I just don't know when. And I think that I'm imagining that the social distancing may be removed, not removed, but I think it'll have the echoes of that same mitigation strategy as a bucket, as opposed to this.
Okay, thank you. So I believe we used to have Virginia specific guidance, and I'm looking at Lacey from the Richmond Symphony, just as somebody I know who's been paying attention to this topic. I don't mean to put you on the spot, Lacey, but I guess I am. Do you know what the current guidance, what do you see as the latest guidance that's Virginia specific? Does it have that requirement in it today?
Virginia, at least from the governor's office, no longer has requirements for distancing for musicians. I haven't looked recently to see if there's anything specific to singers. We put so many strict guidelines in for our own musicians that it was all already covered and managed. They're all vaccinated and boosted and all masked and all the things. But I haven't seen anything new, but as from at least a state expectation, all of those basically went away in the summer months anyways. We've been at regular spacing since the fall, and just implementing everything else.
Thank you.
Yeah.
Couple of questions that I've seen come up in the chat, and so I want to be careful that we don't. I'm going to try and ask the questions maybe that Dr. Beret may have more perspective on, because Emily can answer some questions too after Dr. Beret has to leave us. So this idea of, as you were saying, Dr. Beret, when we go to high risk, that might be the time for people to put their masks back on. Certainly, but though while we're in low, people who are at risk should still be wearing masks to protect themselves. How does the health district plan to, what support do they plan to offer? If venues, for example, say are strongly recommending masks, will the message from VDH and the health district be that it's okay to encourage people to wear masks in those settings?
I think number one, we've always affirmed that their businesses, theaters, organizations have the right to enforce masking where they feel it's necessary. That's not, and that is the purview of that business. Well, okay, fine. As long as you should definitely check with your counsel on that, because I know that some places have actually run, like this is before, people ran into issues where they were businesses and they tried to enforce masking and it became a little more contentious. So definitely check with your counsel on that. But our guidance has generally been, it is always okay to mask. And you may encounter places where you have masks. The masks are required to enter a business, masks are required to be part of this organization. You may find that, some organizations feel more comfortable if their clientele are vaccinated. Those are options that, you need to vet with your counsel, but that you may encounter, and that's going to be part of it. But we will always say that it is always okay to mask. I know that there is some, I guess I'll just say we'll follow. That's the science that we will follow, or that's the science. What's what science has told us, and that's what we in Richmond and Henrico will be following as we do that. And I also want to encourage you that talk to your counsel. You are when you're at venues, when you're at if you're a business owner in a theater, or you're owning a theater, that's your area. That's where you may need to, if it because there is going to be more, more condensed people and you're in medium, you may feel like it's a better, your people are better served, your staff are better served, your performers are better served if folks are masked. I feel like, and again, I can't say what councils will or lawyers will or won't say, that is something that you should be able to do, because if that is your as your organization. But I can't say what lawyers can and will and won't say. So I would definitely check that with your lawyers. Our guidance will always say that's okay.
Yeah, thank you. Always a good tip to check with the attorneys before you put in.
Sorry, it's true. We've just been surprised sometimes.
Yeah, yeah. Another theme that I've heard that hopefully you can add some perspective to, it relates to, so we're talking about removing mask requirement or the CDC guidance is around mask guidance, when to wear it, when not to wear it. And there's some have said that vaccination status doesn't really impact the ability to a person's ability to transmit the disease. And so can you talk about the risk in this, based on what we know today, if we go with if we don't require masks because we're in low, right? But then you have a mix of people that are vaccinated and unvaccinated attending a performance, for example. If we don't require vaccination status to come in, can you speak to
so
that?
let me lean first into the issue around you can still transmit while being vaccinated part, and then lean into the other part. So the first, I do think that we do know that folks who are fully vaccinated can acquire and transmit COVID-19. I do strongly believe, or it does still do a really nice job at preventing severe disease. I would still say that even if it's not as good as 96% when we first saw Pfizer come out, it does still pose some barrier to infection. It's just not as good as it was when we first saw COVID come out and we first saw vaccine come out. So there is still probably less infection than we would have seen and less transmission than we would have seen with no vaccination. And I think what we're seeing is that as we see more and more folks have some level of immunity, it may overall, I don't want to say the word herd immunity because we're not there yet. I'm not saying that. I'm not saying herd immunity yet. But as we have more folks who have been exposed, it is one of those issues where it is less likely, it's again, not as good as it was for the original COVID strain Pfizer, but less likely that you will acquire and transmit. It's not zero, certainly. And we know that, further strains may come down the pipeline where there is immune evasion with that variant compared to whatever we have from our vaccines. We also know that the recency, how recently you were boosted or how up to date on your boosters also has an impact. So that's going to be part of for folks who want to be vaccinated, who are vaccinated, making sure up to date. So just so that it's not that there's no protection against transmission, there's just less, but there is still some, and it's important to remember that. Part two. So what we're talking about in low is it's low and masks, or low and medium, and mixed vaccinated and unvaccinated population. So part of this is predicated on the fact that you will have it's mixed. So you will have not totally unvaccinated population. There's a mixed bag of people who've been vaccinated, people who have probably had Omicron recently, and people who are both unvaccinated and never exposed to COVID. That number is probably diminished. That last number is probably relatively, it's getting smaller, who've either never been vaccinated or never been exposed to Omicron, Delta, one of those. So when you have low transmission overall, so you have low or medium transmission of COVID in the community overall, the idea is that since you've got a mixed population and relatively high population of folks who are somewhere, had some experience with this virus, that masking is not necessarily, and since it's just one layer of many, vaccine's the best layer, masking is another layer. It may not be bang for your buck to need to have to mask in that medium or low environment. It's one of those things where we add it as an additional layer in addition to other mitigation strategies when we really are seeing a lot of disease and a lot of severe disease in the population. And so it's kind of a combination of the population that you're working with now being partially exposed or immune, or having had experience and or vaccinated, plus the fact that when you have less disease around and less severe disease around, and that's the key part, it's less likely to get propagated. So you need to have you don't need to have the extra layer of masking or extra layer of other mitigation strategies. I think I answered your question and not talked around it, I think.
No, I think it's all helpful. I feel like each time you speak, I've got 10 more questions, but in a good way. But to maybe simplify this question a little more, do you think, is it appropriate for venues to still require vaccination status, to require attendees to be vaccinated, or based on what you're seeing in the population, is that not necessary given what we know today?
I think here's what I'll say is that we should do what we can to encourage vaccination. I think there are, I know that mandates work, but mandates can sometimes, there are people who have vaccine hesitancy who have we tend to demonize those who aren't vaccinated. And I think we need to get away from that, because I think that further alienates them and further divides our societies. This is a philosophical, I'm going to try not to get too philosophical here, but I think the issue is that there are people with very real hesitancy reasons, whether it be the experiences over institutionalized, there's a lot of distrust and reasons for distrust that are just going to take time to overcome. And so I think it should always be an encouragement. And even though I know mandates work, I do worry that over time it continues to divide our population and prevent. And although I want people to get vaccinated, I struggle with the fact that by requiring it, are we, especially if especially right now with what we're seeing, and when we're in low in particular, I'm just not sure that it's not also, creating more of a crevasse, a divide between our populations, and where I'd rather be more of a proactive than a hammer. I think part of the reason that we're seeing so much backlash is because people are pushing against being told what to do. And that's where I'm trying to navigate this right, where I really want you to be vaccinated, but I'm seeing kind of the pendulum swinging as people are pushing back so hard against being told what to do. And so all that to say, again, it's really up to council more than to me. I think I would encourage folks as much as possible to be vaccinated. I think mandates are tricky when it comes to both the long-term impacts on our community and the relationships we have with our community members. I think it gets a little tricky.
Okay. And it is still up to each individual organization though to decide what rules they want to put in place.
There will not be Dr. Council, Dr. Miller, but there won't be any state, kiboshes to my knowledge that say you can't require it at this time. Okay. At this time is what I'm going to leave it at, because I don't know of anything coming down the pipeline other than, for performing organizations. I think if it's school-based, that gets tricky as well.
Is there any, I hear you saying there's no requirements coming down the pipe. Is there any guidance planning that would be relevant to performing arts organizations that might be coming out in the near future?
You mean regarding vaccination?
In general, regarding managing COVID.
I do think that as CDC gets to and as VDH gets to, as we get to propagating all our recommendations, all of these changes through our websites, there will be things out there. I just can't give you a particular timeline. What I would say is that if you're in the Richmond metro area, that part of our role as the health district is to help organizations manage that, where that weird gray space between. So organizations should also reach out to us in that intervening time to see if we can help you navigate that. Because I think that there is going to be a gray space in between.
Excellent. I have one more question I want to ask you before you go. Do you have 2 more minutes?
Sure.
So someone, Lisa Catula from Virginia Repertory Theater asked the question about current CDC guidelines. Risk map says that we're at low risk, but according to COVID Act Now, she says that we are still showing as high, and their union requires them to use that source for determining practice.
I'm gonna look at that site real quick because I don't actually know what COVID Act Now is. Sorry, forgive me.
Okay, yeah, I don't either. So, and Lisa,
Okay.
I believe you're on here. If you want to share more about that, you can. But I guess generally, I was going to ask, is the CDC and is Virginia Department of Health working with unions to share their data on strategies and mitigation?
Performing arts unions, you mean, or unions in general?
Performing arts unions in this case, but I think unions in general.
I don't know what CDC is doing with regards to collective bargaining units on the national or the federal level. I know that I feel like it has been more of an issue of relational, where we have relationships we're able to share, and then where we have information, we put it on our websites. So it is, I have found it more successful to work where we've established relationships, because we don't always know about the unions, especially if they're national unions. I think sorry, I'm looking at COVID Act Now. I don't know who they are or what they're doing. I wonder if they're using transmission levels. Sorry, one moment. So we are, it's more of a, I don't know that the CDC areas is not. I think that for us locally and with VDH, it's been more where we have relationships with particular collective bargaining units or organizations that we've been able to really nuance and share more guidance. But otherwise, we try to put out as much as we can on our social media and our websites to make sure they have access to it. But I think it's really more, one of the things we've really gained from COVID, silver linings maybe, has been the opportunity to really build relationships with areas that we hadn't had historically as much before. And I think that's been true not just for unions, but across industries, where we just hadn't had as much of a presence. And so I think that's where we have capitalized on those opportunities, but I definitely think that there's room for more. Still looking at.
I see that Lisa has unmuted herself. Lisa, did you want to add something to that?
No, the website is called covidactnow.org, and it is where you can put in your location and it gives you back a report very similar to the one that I was also pulling from the Department of Health. But the numbers are very different and I don't know where they pull from. So I was just wondering if she might have any intelligence about that.
I'm just looking at, where are they getting?
Dr. Verre, maybe in the interest of time, I know you need to get to something else. If you and Emily are
Sure.
okay, I will be glad to submit a list of questions that we don't get to or don't get answers to.
That'd be good. And we can take a look at that. Sorry, I was trying to see if I could find a quick answer, but I don't have a quick answer for you because I'm not familiar with this website.
Yeah.
But we can try and delve into that some. I did see on the front of their page the acknowledgement that CDC has released new guidance, which we'll be incorporating throughout the site and learn more about community levels. Okay. So I wonder if they will be incorporating that going forward.
That propagation that you talked about, it's got a cascade down from the CDC down into all the other parts.
Right.
That makes a lot of sense. And I appreciate your willingness to come on relatively early in this process and talk to us. You know, when we set up this meeting, the new guidance wasn't even out yet. So once, I feel like
it's evolving. Always
the
evolving.
word that I've learned, as you said earlier, at this time, it's just so meaningful because it just changes it hasn't changed daily so much. So,
I know it's been frustrating. It has been incredibly frustrating I'm pretty sure everybody for how much at this time has become.
Yeah.
My word.
Good. Thank you very much for your time. I'm going to ask Emily to stay on because we have some more questions to get to, and I'm going to share the results of the poll that from this group that talks about where folks are headed with their mitigation strategies.
Great. Thanks so much, everyone.
Thank you. Right, Piper, if you would put up, please, the survey results that we did. For those that maybe aren't familiar with the survey or didn't get a chance to complete it, I'll just share. So we asked a handful of questions around what precautions were you using before the new guidance, and then what do you see as the next phase of COVID in your organizations? And we just wanted to share those results with the group. We also asked, how are you doing in all this as an organization? And so I'll just spend 5 minutes on these results, and then we'll get back to some more Q&A with Emily. Piper, if you could go to the slide 2, please. Oh, there we go. If could you put that in slideshow view so it enlarges the chart? And we will share this this PowerPoint presentation with the group, so don't feel like you need to write all these down or memorize all this. Oops. We had it and now it's gone. Were we able to get that back? I can't see the chart.
Sorry, I had the wrong screen. Both of my screens were showing them. Okay, try this again.
A second ago. We could take it in that smaller view if we have to. Well, I'm going to speak to what the slides had to say while we look for that. So we asked the question, if your organization is currently using safety precautions for performances, exhibits, classes, and other programs, which ones were in place as of February 24th? The biggest ones, as you would expect, requiring masks for visitors and patrons while in the building, while they were standing and seated, with a smaller percentage only when seated, a much smaller percentage showing only when seated. And that was 67.5%. Another 67.5% were requiring masks for staff. 50% were requiring vaccinations for staff. And those were the most commonly used precautions. And then let's go to the next slide, Piper. Thank you. Got it back now. And so then the question is, what do you anticipate the next phase looking like? And this is the one where I've heard a lot of different organizations trying to talk to each other. And so I hope this is helpful information for folks. Going forward, we see a lot of people reducing or eliminating masking requirements, which makes sense based on what we just heard, both for patrons and for staff, increasing attendance capacities, going back to more indoor events. On this one, the primary answers I saw in other as a theme were keeping an eye on the numbers before we decide what to do. Right, so I think that's makes a lot of sense given, as we just talked about, things change somewhat daily. And then I'll go to the next slide, please. And again, we're going to share these slides with you. We'll email them out either later today or tomorrow, hopefully. This is great news. This slide here, how is your organization adjusting to this global pandemic? This is a question, I believe it's the third time we've asked it since the beginning of the pandemic. A year ago, well, first off, the good news is that we have 59% say they're doing very well or extremely well, with another 41% saying they're still doing somewhat well. So this chart would not look like this in many other cities across the US. There are organizations where many organizations have shut down permanently, they've closed their doors. And so each of you as organizations, give yourselves a pat on the back for surviving this long and for the creative ways that organizations pivoted and stayed strong through all this. I don't want to mask the fact, though, that some said not very well. Some are still hanging on. So keep your colleagues in mind. We're not through all this yet. But overall, I think it's a strong message for many of the organizations in the area. And it's about consistent with what we saw a year ago, which is good news. I've always said arts organizations tend to be very positive, forward-thinking, problem-solving kind of organizations. So a year ago, I wasn't as confident and as strong as these numbers were. A year later, I'm feeling really good that many organizations have solved those, the challenge that they're currently facing and are surviving. I will pause there and ask, does anybody have questions just based on the charts? Not about VDH and Richmond Health District questions, but just about those graphs or comments based on what you saw. I can't see the chat anymore. Let's see. Give folks a moment to put a question in the chat, or feel free to take yourself off mute if you have a question about these charts. Okay. Well, I will. I welcome any questions by email later, or if you want to give me a call, feel free. Thank you again to everyone who took that. Emily, let me bring you back into Piper. You can turn off the slides. Thank you, Emily. Let me bring you into the conversation. Any opening comments you want to make before we jump into questions based on what Dr. Beret had to say or what you've heard so far?
Right, I'll just give a brief comment and then I'll use most of the time, the remaining time to answer any questions that you still have. I think right now we're in a bit of a shift, not just in what metrics are using and all of that, but mentally for all of us who have been very committed to trying to reduce the transmission. It's a huge shift for us to think now, oh, it's okay to take off masks. Oh, some of our strategies are going to change. We can go back to normal. And obviously it's not exactly going back to normal, but I do think it's okay to start thinking about how we move forward, because I think COVID is here to stay for a while now. And we do have to adjust to this as a long-term thing that we're going to live with. And so it's okay to be ready to start lowering mitigation sometimes and just following those rates and those community levels that we'll keep referring back to and ramp those back up as needed. So I think that's kind of the shift we're all going to have to make now. And it's a huge shift for me as well. So I understand that as organizations, you're probably trying to figure out how to do it and still keep people safe and make people feel safe.
Yeah, it's definitely a shift in mindset for all of us. Thank you for that. So let me take a look at some of the questions that we still haven't gotten to. One question that came up from the original questions that folks submitted, a lot of organizations are limiting have limited concessions as a risk management strategy. Thoughts on whether that's based on current risk levels? Do we believe that's still an issue, or is it worth continuing those practices?
Right. Well, in the medium and low risk levels or community levels, as the CDC is calling them, masks are not necessarily required for all individuals, even in indoor public spaces. So there's really no reason you can't sell concessions, especially in those low and medium levels. So I think it's fine to sell concessions. There are additional mitigation measures you can put in place if they make you feel more comfortable and if you have the ability to do so. Always being outdoors will decrease the amount of virus that can just be like trapped in the air around you. So outdoors is always better than indoors. But when you're indoors, improving ventilation, just making sure your HVAC systems are working well. You can use things like portable HEPA filters. And just opening doors and windows are things that you can do to make that to improve that airflow. Distancing of tables and chairs if people are going to stop and eat, and if you have tables and chairs available, again, can make it so people aren't congregating with masks off. But if masks are already off in the building, that might not provide that much additional protection. But I think there are definitely ways you can go back to selling concessions if you've stopped, or continue to do so safely.
Thank you. So getting into some more specific questions, Michelle Muller asks, what would you recommend as far as mask wearing for individuals who are not up to date on vaccinations?
I think we're stopping thinking about this so much as if you're vaccinated, you have a different set of rules to follow than if you're unvaccinated, and more thinking about the transmission within the community. So in those low and medium levels, I think if you're unvaccinated, talk to your healthcare provider if you have a chance about your personal risks and assess that. But if you don't have any particular high risks for serious disease from COVID-19, it would still be your personal choice whether you should be wearing a mask or not.
Thank you. This one might be something you can share with us, a link. So Stan Orchowski asks, what's low versus medium versus high? Is it basically, how is that calculated?
Right, I can, I think I've got the page pulled up where I can Google it very quickly. So I'll drop the link in the chat, but basically prior to the newest guidance, we were using community transmission as our way of setting these levels. And we had 4 levels prior to this: low, substantial, moderate, and high. And now we just have 3: low, medium, and high. And so the community transmission levels were based solely on the rates of COVID-19 in the community, how many people were testing positive. And these new levels still have that incorporated, but they also take into account hospitalization rates and hospital capacity to kind of show more accurately how this is burdening our community. And if you were to become severely ill, is there a place for you to go to the hospital and receive care? So that's how, so because variants like Omicron, very highly transmissible, but made less people severely ill, this is a more accurate way of showing the impact of that and basing our recommendations on mitigation on the burden COVID is having on our communities, as opposed to just the number of people that test positive, some of whom may never even have symptoms.
Right. Thank you. If you could share that link with us, that would be helpful,
Yeah,
either during or after this meeting. Can you talk about how important or not disinfection practices are? I think back to the beginning of this, I know some were disinfecting their groceries when they brought them in the house. And as theaters, we've been disinfecting doors and seats and you name it. Can you speak to how important that is to transmission or preventing transmission?
Right, this is a great question. COVID-19, we see spread more often from person to person than from surfaces. So while the disinfection is important, it's not going to have the biggest impact on reducing transmission. There's plenty of other viruses and bacteria that are spread from surface transmission. So disinfecting is still a helpful measure. It might be one of the reasons we've seen other diseases go down during this time, but it's not we don't consider it the primary way COVID is spread. Though again, we kind of think of these mitigation strategies as layered. Masks are a layer, social distancing is a layer, vaccinations are a layer, and disinfecting can definitely be a part of an overall mitigation strategy. But I wouldn't find it to be an effective only mitigation measure.
Yeah. So I think Dr. Verrey offered that it was good to reach out to the VDH to work on organization-specific strategies. What's the best way for someone on this call to reach out to the VDH to ask for that kind of assistance?
Right. The best way would probably just be to email me, and I'll put my email in the chat. Depending on the specific questions, one of my colleagues, Lydia Brown, may be more available to answer them. So I'll put both of our emails in the chat. Feel free to include both of us on an email or send me an email and I will make sure it gets forwarded to the right person if I'm not the best person to answer your questions. But emailing me is a great way, and I'm putting my email there for anybody who does want to talk to us about specifics in your organization.
Excellent. And we are at 12 o'clock. Because we're recording this, Emily, if you're willing to stay on for a few more minutes, I have a couple more specific questions I wanted to ask you.
Yeah, sure.
And folks, you're welcome to drop off if you need to. We will be posting a recording of this session on our website. But while I've got you, Emily, I wanted to try and ask a couple more questions. Sorry, now I lost the one I was going to ask you. So a lot of this low, medium, high is based on the data that we get from the community, but a lot of the testing results now are from home tests and people aren't necessarily reporting those. How does the VDH or the health district take that into account as we're evaluating the risk in the community?
Right, that's a great question. And that's definitely something we've thought a lot about, especially during Omicron. We know a lot of people were doing home tests and we just do not have a way of capturing those in our data right now. But we do know that, first of all, from a data perspective, we're probably capturing at least a fraction of those because many people will take a home test, it will be positive, and then they'll go to a healthcare provider and it will be followed up with either a PCR or even a rapid test that does get reported to us. So we're not going to capture all of them that way, because if people aren't that sick, they might not head to a healthcare provider. But if they have the ability, a lot of them do. So we are capturing some of them in that way. But this is another reason why our shift to the community levels is actually very helpful, because we're not putting all of the value just in the number of positive tests we're doing, and we're looking at other metrics such as the hospitalizations, hospital capacity, to kind of get a better picture of how this is impacting our communities. But we're also looking for other data sources that we can utilize to see what's going on in real time, because the hospitalization rates can kind of lag, which is why we do still include those case rates as another part of that. But another growing data source that we're looking at is wastewater. And I know that the CDC has recently put together a wastewater dashboard that shows the level of COVID-19 detected in wastewater, which might be a better real-time picture of what's happening. And that is still in progress. I think it does currently include data from Virginia. I think we do have some sites reporting to that already. So that's a source that we're looking into for more real-time information. And I think we'll continue to look for other ways to other more unique ways besides just the case rates to see what's going on in the communities.
Thank you. One person asked earlier in the survey data, what's the thought on, given the encouraging of vaccination, right? Encouraging of vaccinations, folks, and there's many youth that have not yet been vaccinated. Are there thoughts about requiring vaccinations as part of school education requirements? Right. So a large part of this, I will have to say, is simply not really a VDH or a local health district question, because it's not really something that we directly control. But what I can say about it is that a couple of things. First of all, for school age populations, the vaccine is still under emergency use authorization as opposed to that full authorization. And it's much more common for vaccines to be required when they're fully authorized. So that's something to keep an eye on as well. For vaccines to become required, it would probably be due to a change in regulations. So that would either be state law that would change, or school boards could set their own regulations requiring vaccines to be required to attend schools. Obviously, we do have a large group of vaccines that are required to attend schools. But then we also have to consider that there's plenty of vaccines that we don't require to attend schools, such as the flu vaccine. And that doesn't mean it's not effective and it's not encouraged.
So that's really going to be a policy level decision that it's hard for us to predict how that's going to go, because we've got examples of vaccines that go both ways.
Yeah, thank you. And I appreciate your willingness to step towards the crystal ball with me. I know our crystal balls aren't perfect, and I have one more crystal ball question, and then we will follow up with any other questions that maybe have gone unanswered. I'll invite folks to email us questions as well, and I'll send those to you later, Emily. But what is the current thinking of the health district and or the Department of Health when it comes to what our risk assessments will look like come this fall? So we know many are in the low area today. What do we think will happen? Do we see that risk increasing as we head into fall and winter months again, or do we think because of herd immunity and other things might stay where it is?
Right. So I think what we're seeing and what we're predicting, I mean, it's hard to say. COVID has certainly been unpredictable up until now, but it does seem to, in a lot of ways, behave similarly to other respiratory viruses like the flu. And we see those increases in the winter, primarily just because people are gathering indoors more. So we do think that there is certainly a possibility for more increases in winter months. We've seen summer surges before. Delta definitely surged in the summer a little bit, but we have seen the biggest surges in the winter, and it would not be surprising to see that continue. That said, I think the best thing that you can do is kind of just keep an eye on the current situation, look for recommendations from the CDC and local health departments as far as what variants we're seeing emerge in the community and what guidance we have in relation to that. Because as Dr. Verey said, we do anticipate there will be more variants. There's still too much spread for it not to be mutating. And so there could at any time be new variants, and there's always a possibility for more increases.
Okay. Thank you very much. I'm going to leave it at that. Emily, I greatly appreciate your help today, your guidance today. And again, our thanks to Dr. Verey. Thank you to everyone for joining us. For me, I'm wondering, is there more that CultureWorks can do to help facilitate further conversation on this? I would welcome your thoughts by email. You can email me, scott@richmondcultureworks.org. Email me your thoughts about what else, other conversations like this. Are there more action-oriented conversations that might be interesting or helpful? Let me know your thoughts on that. And that goes for anybody who might be watching this on video too. We'll take your questions for the health district and for the VDH by email. You can email me, scott@richmondcultureworks.org. And we'll compile those and we'll post an FAQ along with the video with responses to those questions when we put them on, shortly after we post the video. Erin, is there anything I'm forgetting in closing remarks? Thank you. Again, thank you, everyone. We greatly appreciate it. And good luck as we continue to navigate these waters, and good luck and break a leg. Thank you. Bye.
Thank you so much.
Thank you.